Welcome to Kno2fy, a podcast recorded at the intersection of today's problems and tomorrow's care. Hosted by Kno2's Therasa Bell and Whitney Cole, Kno2fy brings together the voices shaping healthcare, from industry leaders and policymakers to the voices that don't always get the mic. We'll get into what's working, what's broken, and the hard conversations healthcare loves to avoid. This is Kno2fy. Let's talk about it.
Welcome to Kno2fy, everyone. I'm Whitney Cole. Today, we're pulling back the curtain on one of the biggest moments in payer interoperability, Clover Health and Counterpart Health going live on national networks. I've got Therasa with me here today. Hey, Therasa, how you doing?
Great. Good to be back.
And then we're joined by Kevin Holub, Chief Product Officer at Counterpart Health. Kevin, how are you?
I'm doing well. Thanks for having me on.
Yeah, you want to take a second and introduce yourself?
Yeah, my name's Kevin Holub. I am the Chief Product Officer at Counterpart Health. I've been with Counterpart and Clover for over 7 years and building at the intersection of interoperability and physician enablement and AI for that whole time. We're really excited to be here.
We are excited to have you. I'm going to give you the first question, and Theresa's going to jump in. I have more for her later, but I want to start with you with this first question that I've got. So before we get into what you've built at Clover and Counterpart, I would love an overview of these organizations. Like, who are you? What makes you different? What makes you, just give us the full run through.
Yeah. So I like to start at Clover Health. Parent company is a physician enablement company. We're a publicly traded healthcare company. And part of what makes us different is that we run 3 business units. We're most well known and our brand is almost synonymous with our Medicare Advantage plan. That's our Clover Insurance Company. We have 153,000 members, predominantly on the East Coast in New Jersey, Georgia, as well as South Carolina, Texas, Pennsylvania. What, however, makes us different and where we've really built a lot of our innovation is that within that health plan, we've incubated and built 2 parallel businesses. One is a clinical practice. We run one of the largest in-home care clinical practices in the state of New Jersey. We have a growing practice in Georgia where our membership is growing as well. And then we incubated and built a technology product called the Clover Assistant. Clover Assistant was then moved out into a standalone business. That's where Counterpart Health sits. That's where my team and I sit. And what we built was a EHR sidecar used by primary care physicians at the point of care to help support the early diagnosis and longitudinal care management of chronic diseases. So that set us up to be pretty innovative and different in how we think about solving problems, and what we've been able to go and solve is that we've really built this physician enablement business. We've set ourselves up to say, how do we help achieve our mission of improve every life? How do we help get the best care possible for patients? And what we believe is that that starts with the physician and the patient in the room and giving them all of the right data, all of the right insights to really bend the total cost of care, get better outcomes, get earlier diagnosis. And we've been able to see that play out in our product and our technology over the years. We've published a number of white papers about our efficacy. We're a publicly traded company, so you can see it in our publicly traded results. And that's been this foundation of innovation that has led us to participate and be excited about the collaboration with Kno2 here and with some of the growing excitement and momentum in the interoperability space.
Awesome. That's a really great intro. Therasa, from Kno2's perspective, we always look for the right partners for Kno2. Tell me what made Clover and Counterpart the right partner for this milestone.
Yeah, I will say, first of all, just to give a shout out to all of our partners. They all put in a ton of hard work to get integrated on our API, and that requires a significant amount of effort on their side to do that. And we find that I would say most partners are mission driven. Most organizations are mission driven. That's not true 100%, but that is true, with our partner community. But with that said, definitely Counterpart, Clover, and I'd say Kevin kind of uniquely stood out, not to make it awkward, and call Kevin out here, but kind of uniquely stood out on their own. I'm a little bit embarrassed to say it, but he actually called me and said, "Hey, Therasa, do you know what we're doing? Or do you know what's going on?" I'm like, "Yeah, Kevin, you're doing this, you're doing that. I'm aware." And he's like, "No, we're going to be live on TEFCA and with the CMS Aligned Network initiative." And I paused for a second. I said, "What do you mean, Kevin?" And so he kind of took me through it, and I said, okay, time to, get ourselves around this one, because really with the leadership of Kevin, Counterpart, and Clover, they are unlike many of our partners, where they've been willing to, just the DNA of the company is willing to push ahead, where there's some risk in that game, and they're willing to push ahead and continue to push ahead for their product. One, I'd say just for the betterment of healthcare, but also for the betterment of their membership, and see healthcare really move. And they've put their money where their mouth is, proverbial money where their mouth is, and gotten it done. The DNA is very different. And they also, I'd say, uniquely, this is kind of a historical way of thinking, but they don't see data as the asset that they own. They see it as something that they need to make liquid to the entire market. And their differentiation sits on not only doing that, but also what they do with the data, not the data itself. So that in itself is a rare combination. Fantastic group to work with, and truly an honor and a privilege for us to be able to partner with them.
And Counterpart Clover uniquely stood out to her. And I think that you kind of touched on this in your explanation of who Clover and Counterpart are, but I'd love to hear the mindset. Like, what is the mindset internally at your organization that helps you look at data differently, helps you look at interoperability differently?
I think Therasa really hit on part of it, is that our mission is ultimately to improve every life. At the end of the day, if that's what your goal is, it includes sharing all of the data, making sure you're doing things that optimize for patient outcomes. That all starts for us from our founder and chairman, Vivek Garipalli. He founded this company. And I joke, I've actually never directly asked him this, but I use this quip all the time, that he kind of started a Medicare Advantage plan as a way to incubate a tech company. He said, I want to go build a new technology business. And the way to do that is going to go raise $1 billion to create a Medicare Advantage plan. And it sounds absolutely bonkers, except for someone so committed to the mission to say, the only way to get to that outcome is to also control and help make sure that the payer is fully aligned to the mission to go and do those things in a different way. So a lot of it starts there and then cascades for our organization through as well. Our CEO, Andrew Toy, his first job in healthcare was at Clover Health. He was a founder of a technology company called Divide that was acquired by Google and then came to join Clover from Google. We just live and breathe every day from the entrepreneurial spirit of our founder and chairman and CEO, and how we operate. We all run that way. We've attracted and built a culture that operates that way. And that, to Theresa's point, is different than the way many organizations start. They start with from the perspective of what is the risk and what would be the challenge of doing this. We're different than other organizations that we incubated those 2 other businesses and launched them. We're different than other companies in that our goal is our mission, and that in order to achieve that, we know we have to build this muscle. We have to provide the data to the networks. We have to make that data available to physicians. We need to empower patients with control over their own data, all in that spirit of really trying to be that entrepreneurial startup. Go back to the spirit of what Vivek and Andrew and others have really been pushing us to do, which is do things in a way that is innovative and different, because that is how we will ultimately see the dramatic change in healthcare that we all need in this country.
I'd like to, I know, Whitney, we want to make sure that we get through a series of questions here. I want to kind of push into what Kevin said there, because a lot of companies, a lot of founders, being a founder myself, you will express things that sound really, really moving, right? So I can say that we're a network for providers. That is our entire focus and the decisions we make around that. And then reality hits in the moments that you have to make hard decisions. That's where the definition comes out. It is not the mission statement that's put on a wall. It is not what's professed on your website. That's great. You need to do that. It is in the decisions where there's risk, where it's not obvious, where, it may be a long play and you're choosing. I can personally attest to this. You're choosing to not make the biggest dollar right away. And those are the decisions that if you don't have the intestinal fortitude at the very top to push through those, you will not meet your mission. And that has been very evident to me, that the founder who's pushing it forward, it's in the DNA of the entire organization. But unless in the hard moments, I always say in the wee hours of the night, when the decisions are sitting in my brain, so I can just I can assume this is true for the founder of Clover. It's like, man, this is a tough decision. I've got the business board side of my brain saying this, and I'm looking at this and saying, I know the long play here is this, and this is right for what we're doing for mission. And in those tough moments are what define a company and what bring it to reality to achieve what Counterpart and Clover are achieving. So just wanted to double down kind of on what he said, because that gets lost often with mission driven founders. The tough decisions get made in the wee hours of the night to push forward.
I think there's a reason most payers haven't done this yet either. So I'd love to hear your perspective on that, Kevin. I think, and I could be wrong here, but I think it goes back to what you were talking about with incubating a technology company essentially as part of the overall strategy. Were you building your own infrastructure? Like, tell us more about that. Why could you move quickly in this area?
So it goes back, as you noted, to our lifeblood as a counterpart has been this incubated technology product. And that started back from Vivek's vision that in order to change healthcare, the payer is sitting on a massive amount of data that is not well shared. Right? That is actually where a lot of the innovation started from, is how do we give that data back to physicians? And there are a lot of payers that share data with providers. Usually that ends at they share data with Epic and Cerner-based EHR hospital systems. But that isn't where we grew. That isn't where our membership lives. We have a lot of members in New Jersey and Georgia and South Carolina. We have a lot of rural customers. That's not their life. We can't just send them a claims extract and Epic's going to pick it up and figure it out. So what we knew we had to build was a technology that really gave every independent practice, every physician in the heart of their community caring for their patient population, access to the data that they needed that they couldn't otherwise get. That is really where the kernel started from, and that was the first version of Clover Assistant. And we've then built and scaled that. We said, okay, what else can we do to empower those physicians? How else do we get them more data? How else do we get them the right insights? And that's where a lot of the innovation came from, is marrying that administrative and claims data and payer data set with the clinical data set that a provider might have available to them and bringing those all together. So if a few years ago, as the networks were continuing to really mature, we saw a lot of innovation. TEFCA and with what is happening in the administrations was continuing to push more and more in those directions. We were connected to the point that I called Therasa up. I said, hey, we're doing this already on the Counterpart side. We're ready to go live with Clover. We've got all the data. We've got it ready to go. We want to just start responding with this data as well, so that our providers and our users of Counterpart Assistant, they already had that. But our goal is get it to everybody. How do I get this now to every other practice group? We were ready to start responding and sharing that data equally. Because again, our goal is, and as Therasa said, in the middle of the night, you can make the decision of, well, only our customers are going to get the data. Or you can say, well, no, our mission is improve every life. If this helps improve other patients' outcomes, let's get the data out there and share it. There's a separate question of how do we monetize? How do we build a scaled and growing business? That's our problem as a business to go figure out, but that shouldn't get in the way of our mission. We should be doing what we need to do to improve patient outcomes. And I think we have built a successful business to be able to do both and scale that up. And so for us, it was an obvious choice to say, hey, let's share this data. Let's go do this as quickly as possible. We built the infrastructure. It started from some of that innovation and idea. So the moment kind of perfectly hit together. And I'll call out, and I think, they owe a lot of credit to CMS of instigating these communities to say, do it. Let's not talk about it. We don't need to follow the regulatory path of the minimum viable. If people are ready to run, let's let them run. And so we're really excited to partner with Kno2fy, to partner with a bunch of organizations, the CMS health tech ecosystem, where we all want to run a lot faster than the regulatory floor. We need the regulatory floor. I'm not saying that's a problem, but I think it gives us an opportunity as innovators and groups to come together and say, we could do better and we can move faster. Let's do it.
So I think it's important, Whitney, if I look at some of the just kind of an external view of working with different groups, different payers, and then working with Clover, their willingness to break barriers, because a lot of payers, especially ones of size, huge ones, they have a lot more administrative burden and overhead that they are pushing through red tape, let's call it. So their willingness, and that has to come from the top, to push through the red tape, not see the red tape, push through it. Their view of the data and how they, the data is in itself is not necessarily an asset they're looking to commoditize, or not commoditize, to monetize, but make it available, the mission. So back to the mission. And then I think a really important point on what Kevin said is meeting the entire provider community where they're at. Everything, and this is no disrespect, has been geared towards Epic and Oracle. We've talked about that in the provider communities. Again, no disrespect to those groups. That's obviously a huge percentage of the provider base. But there's a much bigger provider base that sits around that has been ignored and continues to be ignored. But until we close those gaps, we won't have a connected ecosystem. So those kind of just that mindset is what starts to break down the existing barriers. And then whether they like it or not, they're trailblazing, and others will follow on that, because now it's been proven that it can be done, where we got to hide behind it as an industry that it hadn't been done. And it's like, oh, it's regulation, or it's too difficult through the frameworks, or all these reasons, and just plow right through it and say, yep, it's capable. We're capable. Let's, for anything that was, done in the process that maybe we didn't have quite perfect, we'll go back and fix it and get it right. But we got through and said it's done and it's capable. So, all that said is it's the mindset at the end of the day that pushed it ahead.
I want to start talking about what it took. So Kevin, you started to get into this, I think, a little bit with talking about being live on CMS and TEFCA. Walk us through what that means technically. What did it take to get there?
The root of it on the TEFCA side and IAS and treatment is responding back when someone has a valid reason to say, I need my data. That's ultimately how I look at the problem, is either a provider's treating a member or a patient and they say, hey, do you have information about this patient? Or an individual is saying, hey, I want my own data. Give me my data to do what I want to do with it. Our job as a covered entity, and Clover Health in this case, is respect the wishes, follow those goals and give them their data. To technically do that, for us, it's been really nice, is we have Kno2fy. I think Therasa and team have done a good job talking about simplifying the problem into 3 different patterns: send, search, find, receive. I apologize, I'm getting them slightly wrong, but it's...
Yeah, it tells me we need to mark it. Sorry, with.
But there are 3 pathways, right? And so for us, the integration was, okay, we need to do that. And what we needed to start doing is, for requests that came through for patients in the Clover data set, respond, right? The same response we would give for a treatment request of clinical data, we should respond with now the claims data. So we incorporated that. Now, part of this that we appreciate is we're a FHIR native organization on the Counterpart side. So we already had, under this framing, the CMS blue button or Karen definition of FHIR EOBs and responding with that data. That's what we had. I'll actually note it's one of the conversations we've had with Kno2fy, and we kind of joked about, is we are on the fly going from FHIR to CDA. We're probably the only organization going backwards from that perspective. So we really appreciate that now we don't have to do that anymore. We can just respond with that FHIR data directly. Now, what does it take? As Theresa said, we're one of the early adopters here. It consistently takes running down the small little edge case bugs that get in the way, and the willingness and partnership to do that. We've had multiple weekends and long nights, partnership with Kno2fy as well as other partners in the health tech ecosystem, of running through, hey, this didn't work. Why didn't it work? And doing that work of going down the long tail of finding the little gotchas and concerns and issues. And we're early, so when you're early, that happens. So part of the work, and what does it actually take, is the commitment to go and do that. Because if a patient wants their data, we got to get it to them. So we're going to work to get that one patient data query unlocked. And then once we do it once, the next one's easier and the next one's easier. And that's that's normal. That's where we expect to be. And I'm excited that we're making that progress now. And we're starting to break down those barriers that have historically existed for payers to participate and share that data.
So let's try to make this human if we can, because that's, why we're all here. What does it mean then for that patient who, maybe somebody managing multiple chronic conditions, what does it mean now that their data is finally flowing? What does that look like for them?
So I have kind of two perspectives of it. One is there's a glib answer the industry is often given of the data was available. CMS pushed years ago with CMS patient access APIs. Those were good. That was progress. It was a pathway to do this. You had to go to the payers portal. You had to log in. There were a bunch of rules around it. There was a lot of obfuscation, and there was very little utilization that ever showed up there. So the first part is we have to meet patients where they are. Patients don't want to have to create 45,000 portals. They don't want to have to log into their EHR and their payer website. I'm very proud of our plans, but I don't think our customers think of us necessarily off the top of their mind of, oh yeah, I had Clover insurance 2 years ago. What they just want is, I want my data, can I get it? So I think a big part of the first step for patients is removing the barriers to their data and putting it in places that makes it easier. There's been a lot of progress there. So I think something that's really helpful is now an individual can scan their face through any of the different vendors. They can do an IAL2 token and say, hey, this is me. We agree that when I take a biometric scan of my face and I scan my ID, we trust that this is only you doing that. It's on all of us to say, yes, we're going to give you your data, instead of making them go through more hoops. And then the second part is the claims data isn't a perfect picture, but it is a very large longitudinal record. Because ultimately, every time you see a doctor, every time you see a clinician, every time you go to a lab, somebody has to pay for that. That's our job. It's in our name as payer. That's what we do. So we have a record of all of those transactions. So instead of having to piece together, did I get the whole patient record? You now kind of have a foundational baseline. I see all of the events that have actually happened and a little bit of clinical information, right? I've got what are called CPT2 codes, or you've got the clinical events that are happening. You've got the diagnoses codes, or what are the diagnoses associated to this. You have some idea, but then you can combine with the additional rich clinical documentation to get to a fuller picture. So for patients, you now actually get the two pieces. What care did you receive? Where did you receive it? And then you can combine that now with the clinical data from those sources to get the rich context about the care that was delivered. So I think it really does bring those pieces together so that we as patients, and I, for instance, I've got 2 young children. I can't remember every doctor appointment they go to. I wish I could, but they're little. They go all the time. Well, now I could just pull that data through the network. I'd get the longitudinal history. I'd get it in the application of my choice. If you use ChatGPT or Claude or Google or whichever tool you use, we want to empower it there. And so these are really nice progress to make it easier for patients to get access to what is ultimately their data. And I'll hit on the other part, which is the provider side. So often we focus on what the provider has in their EHR. It's a thin slice of the total patient journey. What we want to bring is the full context to that provider so that the provider has the right context when they're talking to the patient as well. We've seen so much value in giving providers that data at the point of care that they can then more effectively help you manage your care. They can see you're seeing that cardiologist, or maybe you're not seeing the cardiologist that you're supposed to see. They can help guide you through the care that you need more effectively so that we don't keep asking patients to be their own perfect historians and their own perfect longitudinal records. And it's too much. We need a system that can handle it and technology that can support it.
I'd say as a patient, Whitney, just to kind of emphasize what Kevin said there is like the ability to see all of your claims across your payers. Because most patients, Kevin probably knows this stat. I don't know how many payers a patient has in their lifetime, what the average is, maybe like 3 or 4, maybe more. But to see all of your claims across your payers is really kind of cool. And you look at what you can do with it. One, who knows, right? AI is going to make it there's a lot of opportunity with claims data, but price transparency, that's been a big part of this administration is price transparency, give access. Well, now I see it firsthand. And I've always said patients, especially patients with insurance, they're not real sensitive to the price of what things cost because, like Kevin said, my payer pays for it, right? And if it's in plan, I'm not real aware of that. And that's good or for bad, right? But as a consumer, if I'm going to go, buy a pair of boots or I'm going to go buy a purse, I want to know where I'm getting the best deal for the purse that I want, right? And now I have transparency into pricing that I see what was actually paid for it. So I can make some decisions. I can get a good sense for what the cost of my services are. Two, from a care coordination perspective, it sounds odd, but the ability to see, as Kevin mentioned, across all of the services I've had performed, and I can use my dad as a very complex patient here, the ability to see that summary of what services he's had performed and then get access to the clinical data, but just to see that summary, super valuable for what I'm seeking to get done or managing care for my patient if we're trying to empower our patients and their caretakers to manage their care. And then another one that I was thinking about, it's kind of weird, but it's error prevention, right? So there's a lot of things that get filed on claims that shouldn't have been. I can attest to this from some previous personal experiences where, I had a loved one in the hospital that had a extreme respiratory condition, and I was responsible for managing it. And I looked at the claims that were billed for, and one of them was like intensive behavioral health services. I can't remember that, but I was like, did they have a behavioral health? Did they have a mental breakdown when I wasn't there in the ICU with them? Because I don't recall this happening. And it ended up being, I won't say it was fraudulent, although it was very strange. But it ended up being a significant expense that got pulled back, right? So that, and that's not an ideal thing to happen, but it happens, and it happens a lot. So the ability as a patient now to kind of take my destiny into my own hands again and get that data back from a payer. And the final piece, and maybe Kevin, hopefully I'm not getting ahead of you here, is like Clover they're coming to the finish line. They need providers to participate back, right? They need to engage. And so they're saying, hey, you know what? We're going to go first. We're going to show a bunch of goodwill to the providers and the patients with the spirit that, hey, we think this will be enough goodwill that providers will return, right? They'll return the value and return the data back that Clover needs or that Counterpart needs to help do things like risk adjustment, to help for, some of the care coordination activities that they're involved in. So there's just a bunch of opportunity and benefits that come off of it, that it's just a good move for Clover to make first. So I didn't mean to double down on what like Kevin said, but I think about it as a patient and what I could do with it and the different situations I've been in. And I think it has huge opportunity.
I agree. Yeah. Therasa, Kno2fy's private network is part of what made it possible, part of what made this milestone possible, and made it possible quickly. Can you talk about the private network and what it enables that maybe isn't available in other places yet?
Yeah, first of all, I'll give a shout out to our partners that have made the private network possible. We've got a wide range. In particular, I'm going to call out our EHR vendors in this scenario, they've signed up for the outcome, same as Kevin. They've signed up for the outcome. They didn't sign up for whatever TEFCA tells them to do or whatever, we see with different network initiatives. They've signed up for sharing clinical information at scale with patients, with providers, with payers. And they have shown that to be true. And so we've been able to, I would say we have a captive audience in our private network that we've been able to make a phone call. I can pick up the phone, I can send an email and say, hey, we got a really cool thing happening here. Would you participate? Would you willing to put some, stop a little bit of the presses on your side, bring in an engineering resource or two, bring in a product person, with normally a deadline of like a week or 2 weeks. And we've had some real time situations here in the last 2 months, and shout out to all of our EHR partners. But we've had some ones come right to the finish line and say, you bet, we're there right with you. In fact, the opportunity this week, as we know, CMS has a demonstration this week. And yet that's another partner, an EHR partner on Kno2fy's private network that we were able to call. And we're not, the benefit of our private network, because we run on send, receive, find, to go back to Kevin's statements, is that find traverses not only TEFCA, care quality, right? All the national networks, but it also traverses Kno2fy's private network, which is as large, if not larger, than those two networks, at least as it sits today. And we can call and say, open up your pipes for this. We'll walk through all the legal compliance, make sure all that's covered. Open up your pipes for this and allow it to happen, and let's push in. And that's exactly what we were able to do with Counterpart and Clover, to get, first of all, the HIMSS, and then continue push down the CMS Aligned Network initiative, and now this demonstration. So it's just a continued progress that we've been super fortunate to have partners on our side of the equation, EHR partners in particular, and their providers, to say, yeah, we'll participate, and we will see, we'll put money where our mouth is again, and we'll make this happen, because that's what they signed up for when they signed up with Kno2fy.
As a customer, it's been a really big benefit for us as well to be able to go through a lot of that with other partners that are ahead of where the industry is at times, right? We're excited. We're now live on TEFCA with IAS and treatment queries, but we were able to be live almost a month ago with Kno2fy at HIMSS on the private network, proving this out, testing these pieces, getting things done, which enabled us as we progressed and got ultimately to this point to be live on TEFCA as well, that we could do this and we could run down some of those bugs. We could do that first iteration of testing. And as Therasa said, there's a big enough network there. There's real volume, right? We could respond with data. We could query for data. We could start working through the pipes. We had to figure out what is the format. We actually bundled the FHIR data over the network to be shared with another provider. It wasn't done before. No one had done that. So we needed to figure it out. It gives you this space to go and try those things. And I think that's important both for Kno2fy, it's important for us as a customer of Kno2fy, and it's important for the industry to have these sandbox locations where we can move faster, we can innovate, and then we can promote to the larger network. And that's what we've done now in a way that allows that progress to happen. And we've set up a playbook. We know how to wrap the FHIR data. We know how to share it over the networks. We know how to do those pieces. We couldn't have done that live on TEFCA at scale on day one. We need somewhere to do that. And I think it's been really exciting to have that on the private network side and on the Kno2fy side as well. It opens up, and we're very mission aligned and meeting those practices in smaller organizations that don't necessarily, right, always go through Epic. Epic is a great partner on the networks, but there's also smaller groups, physical therapy, dental, smaller EHRs and practices that aren't typically included. The private network on Kno2fy has a lot of those participants, which allows us to also help get that data to complete that picture back, to give that full access for that sicker patient, the chronic patients. Putting this human again is, if you go see a doctor that's not on an Epic system, it's often harder to get that data shared. Kno2fy's private network and organizations that participate in these networks can now make more progress there so that we're not leaving them behind anymore.
I wanted, Kevin said something really important there with physical therapists. I'll give a shout out to Raintree. We have multiple PT EHR partners that are doing an awesome job. Raintree they've completed the entire integration of all the interoperability specs that we've given them. So shout out to them. But I want to draw attention to an example of what we're talking about with the payer being live. So let's say a physical therapist has a patient present, and this happens to be a real scenario that we submitted to CMS. So I'm going to use it as an example. Patient presented unexpectedly with a hip replacement. Didn't have any detail on this patient. This therapist didn't have any detail. And so unless they know certain things about this hip replacement, they don't know what kind of treatment plan they can put forward. Now imagine if they go out to do a query using treatment as the baseline, and they're really intending to query the physicians that were seen before, the surgeon, everything, and only, let's say the referring physician and then the orthopedist or the surgeon, we have those two constituents. And let's say the primary care doc was on the networks, the national networks for query for clinical information, and the other one wasn't. And so now I have an incomplete record of that patient that says I can see the primary care referred out for this surgery or had, coordinated for the surgery, but I can't actually get to the surgical record. I can't actually get to the detail here that's going to matter to me. and I don't know where it's at. I don't know what's happening. And so they also queried Clover. Let's just say that's the payer behind the scenes. And Clover showed the claims for both. And they were able to get to some of that detail. Well, at least now I know that I have this gap that I'm going to maybe make a phone call. Unfortunately, we want to get that provider in line. But now I know I can go get that record from that surgeon, because the claims data was my backstop here to say, hey, I've got all these points that happened along the way, and now I can go close that gap. However, I close that gap, because I want the complete record of this patient. That's when he brought up physical therapy. I'm like, you know what? That would be a great discussion to have here, because that shows one of 100,000 examples we could come up with that say, this is how claims data could be used and why it's as important as that clinical data to be made available. So that's just a small example that I want to touch on when you said it, Kevin. You triggered it for me.
As we wrap up this episode, I want to talk just about what's next. So Kevin, Therasa, from your seats, from where you're looking, is there a wave of payer adoption coming? And then what does that look like? Kevin, we'll start with you, and then Therasa, we'll come back to you.
I think there is continued progress happening. So I do think that we will hopefully see a wave of progress happening here. Again, the credit to the CMS health tech ecosystem. They've brought together a bunch of participants. We sit in the payer work group, and we talk with all of the other payers, and everybody is working hard to do this. And so I think there will be progress, and I'm excited about that progress. What will it look like? I think it will look faster than what we've historically seen, but I don't think it's going to be an overnight light switch. We'll likely get some of the leading payers, and the bigger payers can get there, but it will be hard to hit all of the local payers, all of the smaller groups, getting them all the way connected. So we'll make a good dent in this first wave, and there will be a long tail, just like there is in all of healthcare, for us to go and say, let's not forget about the long tail. Let's go keep enabling them and helping those organizations also share their data, also help their patients in these ways, and support them.
I'm here to speed it up, Whitney, whatever that is. So we'll take our private network. We're going to knock down the barriers and continue to push it. And I think we can accelerate things quickly with payer adoption and get it moving.
Well, thank you both for being here. Kevin, thank you. Therasa, thank you. We will see you all next time.
Thank you so much for having us. This was great.
And that's a wrap on Kno2fy. To learn more about Kno2, or if this episode sparked something, visit Kno2.com. We'll see you next time.